Good morning and warm welcome to Online Anaesthesia, an anesthesia update in Zoom platform, sponsored by Akula and hosted by A1 Logics, and our media partner is Anaesthesia TV. After a year-long academic activities, this session we are dealing with the stress relief and money management topics. To know how to balance work stress with yoga and laughing, here we have eminent scholars Dr. Chaitanya A. Kamat and Dr. Ganesh Choudhari in our online anesthesia platform. Welcome you, sir. Welcome you, madam.
Thank you.
After retirement, how to lead a peaceful life by effective money management. To advise regarding that, we have Dr. Kumaresh in our platform. Welcome you, sir. Today's session is moderated by Dr. Karthik, the consultant, Madurai Meenakshi Mission Hospital as a finance advisor, and Dr. SIVAPRASATH, Assistant Professor, Madurai Medical College as a yoga expert. Over to you, sir.
Good morning. Welcome to all of you. So for the past 2 years, we have been running academic programs right through weeks and months. If you look at anesthesia, it's one of the most stressful jobs. Managing surgeons, managing patients, managing time, managing the family, managing the money, everything puts a lot of stress on the anesthesiologists. So once you know how to manage all this, you will have a stress-free life and you will be able to do more anesthesia for a long period of time, as well as having a good work-life balance. So to educate you on this, our Chaitanya ma'am has come. She is the professor and head of Jawaharlal Medical College, KL Educational Institutions in Belagavi, Karnataka. She herself has finished her yoga courses from Nashik and she is practicing. And she is going to share a lot of wealthy information today of what she has experienced. It's not that what she's read, it is what she has experienced through her professional life, through her family life, how she's able to balance that. All this she's going to share with us. So let us watch with more eager. We're all waiting for you, ma'am. Welcome, ma'am.
Thank you, sir. Thank you for the nice introduction. I'll start sharing my screen. Yeah, at the outset, I want to thank the Online Anesthesia Update Forum and all the members, Dr. Rajesh, Dr. Edward Johnson, sir, Dr. Karthik, sir, Dr. SIVAPRASATH, sir, moderators, and the entire team for giving me the opportunity to share the views on this particular topic, which is my favorite, work-life balance, looking back, yoga and meditation. Yeah, we all are aware that we have been practicing for so many years. Anesthesia is a very rewarding specialty. High amount of job satisfaction is there. You get the professional kicks. It's very rewarding many a times when you give life to the patient. But it is also demanding, both physically and mentally, as we are multitasking most of the time. There are a number of studies to prove this, that burnout is common among anesthesiologists. It is predominant in males. There is low work satisfaction rates. It's in most of the countries. Many studies have been done to prove all these things. There is incidence of depersonalization. There is good news is that there is no difference between married and unmarried. There are many studies on that. Males practicing anesthesiologists, the prevalence is more in males. Even anesthesiology postgraduates find it as a challenging job. And among postgraduates, females are more stressed. The mean age of death for anesthesiologists is around 7 to 13 years younger compared to other physicians. And there is higher risk of suicide among anesthesiologists. So if you see all these facts, it is very clear that the specialty is highly demanding job, and there is a lot of work stress associated with the faculty. It comes as an occupational hazard for us because we do long hours of work. Many times we have to do night shifts. There is overload of work. There are stressful crisis situations. You have to do so many procedure skills, and you have to work according to other schedules. So you feel that it is uncontrolled work environment. There is family you have to balance, and there's a pressure on time, being on time. There is sometimes the inadequate institutional support, the private practice, and nowadays the fear of impending litigation is high among anesthesiologist. So just see what is this. Let us see what is the stress. So stress is nothing but our mind and body's response to a real or imagined threat. It is actually a basic physiological survival mechanism, what we have been studying, that is fight or flight response. So when it happens, when there is a perceived imbalance between the demands being made and the ability to meet those demands. So in simple words, stress is nothing but pressure upon resilience. Most of the times we don't have the control over the pressures because they are external most of the times. But we have the capacity to increase the denominator, that is resilience. That is nothing but our inner strength. When it is adequate, it alleviates most of the stress. So what happens during stress? The threat is registered in amygdala. We all know hypothalamus, pituitary adrenal axis. So there is release of so many neurochemicals, hormones, epinephrine, norepinephrine, cortisol. When it is prolonged, there is ACTH, vasopressin, all this, and they all have effects on every cell of our body. And when sometimes we enjoy the stress, when you when you come over the stressful situation and the patient improves, and when you give best of your ability and you improve, you give the it gives a kick, professional kick for short periods, and you enjoy that. Some amount of stress should be there in life. Then only we decide to come over that, work more, work hard, work with more skills, update ourselves. We do all those things. So stress is required, but in an optimal amount. But when it becomes persistent and we are not able to cope with it, then the problems begin. Like anxiety, depression, sometimes addictions, and so many like hypertension, diabetes, all these things may start in our body. And burnout is mainly, it happens when the stress levels are high and they're persistent for years together. So it's a syndrome of emotional exhaustion, depersonalization, and lack of personal accomplishment. And it also becomes evident in our work also. It becomes quite evident. So the person starts withdrawing from the work also. So it leads to overall medical errors also. It may lead to. So yoga is one such gift which can help us to alleviate stress and build the resilience. So it's a gift of ancient Indian tradition. It is very old, actually. It is more than around 8,000-10,000 years old, because its mention of yoga is there in our Mahabharata, which happened around 5,000, in Ramayana, which happened around 7,000 years ago. But it was Yogi Patanjali who has combined all the subject, and he has given us a great book known as Yoga Sutra, which is around 2,000 years old treatise. Yoga, yuj, means to join, to yoke, or to unite. It is said that it's a union of individual consciousness with the universal consciousness. Even modern scientists say that everything in the universe is just a manifestation of same quantum firmament. So the one who experiences this oneness of existence is said to be in yoga. There are around 8 components, like yama, niyama, dhyana, asana, dharana. Last comes the samadhi and nirvana. But mainly the 3 components, at least, we all can routinely, inculcate in our daily routine and practice. That is asana, pranayama, and dhyana. Asanas we all know very well. Like most of the times, yoga is said equivalent to asanas. Like we think like that, but it also has many other components. The asanas are the physical postures. It is the integration of mind and body through the physical postures. It definitely improves the body flexibility, strength, and fitness when it is done routinely. So in Hatha Yoga, there are around 84 asanas. But there are many modifications. So now you may see many of the modification of each asana. And Surya Namaskar is combination of, it's called as wholesome, like balanced yogic postures, wherein every part of the body is involved in that. So it is a best exercise to do. It's best physical posture. But it doesn't. One thing is, when you start doing yoga, you realize that it is not just physical, because you also align your breath with the yogic postures. When you go to a posture, you start inhaling, exhaling in particular asanas. When you follow that, you start getting not only this body flexibility strength that definitely improves. Flexibility is just it is very much evident within a 15-20 days of regular yoga practice. You will realize that you have become so flexible, and even the strength improves over a few months. But beyond that, it also affects our sense of well-being, the stress free. You're so calm, composed. All these effects are seen even with asanas when they are done regularly. But generally, people think that it is just physical postures. Of course, there are physical benefits. Along with that, you have mental benefits of all the asanas. You may not be able to do all the asanas, so you usually split them. Like one day you can do supine pose, standing exercises. One day sitting exercises. One day sleeping supine asanas. One day the asanas in the prone position. Like that, you can split and one can do the asanas. Then comes the pranayama, that is nothing but the regulation of breath, leading to integration of mind and body. Deep breathing itself is a very good exercise. We know that we have so many unused alveoli left. When we know that when we give anesthesia, with induction of anesthesia itself, we see that atelectasis changes. So deep breathing and that inspiratory hold, how much it improves oxygenation, we know in patients. So the same way, when we do the deep breathing exercises, it opens up most of our alveolar dead space, and it helps the body in getting more oxygenated blood and eliminates the unwanted carbon dioxide and other metabolic products. But the effects are beyond the physical or alveolar expansion. As I told you, there are so many neurochemicals, so many good hormones are released during these regulated breath exercises, which only one can experience when they start inculcating all these practices in their daily routine. Dhyana is nothing but meditation or contemplation and uninterrupted flow of concentration. So, as I told, it embodies unity of mind and body, thought and action, restraint and fulfillment. There is amount of harmony between the man and the nature, and it's a holistic approach to health and well-being. That's why there's so many countries, they have included yoga in all the school syllabus, and all the children are made to learn at a very young age. And yoga is not just about exercise. It is to discover the oneness with ourselves, the world and the nature. The aim of sadhana, as told in our scriptures, is to overcome all kinds of suffering and to attain the self-realization and mukti, nirvana, kaivalya or moksha, as it is explained in our scriptures. Buddha was once asked, "What have you gained from meditation?" He replied, "Nothing. However," he said, "let me tell you what I have lost: anger, anxiety, depression, insecurity, fear of old age, and death."
Okay, problem.
Meditation in Sanskrit derivation, it medha means wisdom, and in Latin, meditare means to think or to exercise the mind or to heal. Meditation means awareness. Whatever you do with awareness is meditation. It can be just sitting in a place and just observing your breath, just feeling the breeze on your face or on your body, or just listening to birds or listening to music. During our childhood, we used to put rangolis in front of the house for hours together. Now I realize that we used to get lost in that process of putting the rangoli. Even our moms used to do the puja for hours together. They used to get lost in that. So all these things which are done with complete awareness can be called as meditation. So it's a state of consciousness when the mind is free of scattered thoughts. One channelizes the thought towards one particular thing with complete awareness. So, and when you start doing it, one realizes that all the activity of mind is reduced to one. And meditation is not a technique, but it's a way of life and a cessation of thought process. Now, just understand a little bit about the thoughts, because we deal a lot about thoughts when we start meditating. So there are every thought has at least 4 impacts. Like it creates a feeling, it affects our each and every cell of our body, it affects the person we are dealing with, and also the environment. Like, when we are angry, it influences my feelings. Definitely, it creates some amount of unhappiness in me, and it influences my body, and it may lead to illness when it is persistent. And it also reaches the people whom I am dealing, and it creates the conflicts in the environment. So the thoughts can be positive, negative, and necessary thoughts, like when we think about the work and the to-do list of the day. And so many times we generate waste thoughts, like how many hair I have on my head, like that. Sometimes we start getting waste thoughts also. So generally every day we create around 30 to 40,000 thoughts. And when we are in negative mood, we create around 50 to 60,000 thoughts. That's why it leads to sort of mental fatigue, or we can call it as tension headaches. And they say that to combat one negative thought, we have to generate around 17 positive thoughts. Then only that effect of negative thought is nullified and you start feeling better. So start thinking positively so that the bad effects of negative thoughts doesn't happen on our body. But there are no medications to reduce the thoughts, thereby reducing the stress. But meditation definitely helps for channelizing our thoughts, developing more and more positive thoughts. Let's also see some about emotions. Like in a struggle to fulfill our responsibilities, many a times we go through so many emotions like anger, anxiety, fear, jealousy, expectations, and they all lead to emotional illnesses, and we don't even realize what is happening. So it is time to realize that this happiness, compassion, and acceptance are very normal feelings, which we are nowadays lacking in our stressful or busy schedule. So taking care of the inner world and then doing everything in the outer world creates the happiness. So let us explore how yoga and meditation creates this. So there are many studies again. What are the health benefits of the yoga and meditation? They have been done all across the world. What they say is there is activation of prefrontal cortex and thalamic reticular nucleus with regular yoga practice. And there is more and more activation of parasympathetic activity. Like so many times we do the space exercises, and we realize that which has got most of the vagal supply or parasympathetic supply. When we sit and start doing those sukshma vayamas, you realize that your mind becomes calm, and your heart rate also it comes down drastically. My heart rate used to be around 80 odd earlier. Now it is in 60s. So it is very much evident that the parasympathetic activity, which is actually during our, children, they laugh a lot and they have higher parasympathetic activity. But with time, with all the stress, what happens? Sympathetic activity overtakes the parasympathetic activity, and then there is release of these stressful hormones, sympathetic hormones, which lead to all these problems in our life. So with yoga, we go back to enhancing the parasympathetic activity, which will definitely bring your heart rate, blood pressure down. It makes you much more calmer person. And there is, of course, increase in the GABAergic drive, and there is increased level of beta endorphins and anxiolysis. And there's something called as non-judgmental awareness that becomes very, it is very clear once you start doing. Even like you will do whatever you do with 100% concentration. If not 100%, improved concentration will definitely be there. And earlier you keep forgetting things, no? That also comes down. Your memory power increases, what I want to say. And you are more aware of what you're doing. Even in OT, I have observed this. Earlier, I used to forget whether when I gave drug and all that. Like I used to cross-check. Did I give and all that? All those incidences also come down. You will be more aware of what you're doing, what is happening around you. And you will start being more in present moment. And definitely there is improvement of the cortisol homeostasis, and there is functional, it happens because of functional differentiation of the parietal lobe. So all the benefits will be there. As I told, there is reduced level of blood cholesterol, and the habits, you can get rid of habits, or at least you will reduce. It enhances the immune system, and good improved quality of sleep also improves, especially when we do the yoga nidra and so many, after doing all the asanas, at the end we do activity or kriya called as yoga nidra, wherein you just lie down or sit and you observe all the, you give attention to every part of your body, and you relax that part of the body. And then after that, when you sleep, you get such good quality sleep, like you feel like you have slept for 2-3 days, like that. Even if it is you have slept for 2 hours, you feel that you had a sleep for 2-3 hours, like that. And after that, your mind will be so clear, you'll be ready to take any task. Even just 10 minutes of yoga nidra is very helpful. So, and there'll be overall improvement of the psychological well-being, and there is definitely boost of the self-confidence. It improves a lot, and it facilitates overall positive experiences, and reduces the pain perception, and all the effects will be quite evident. So during meditation, there are a lot of meditative techniques. People follow different techniques, but with time we'll come to know that we have our own technique. Nowadays you get so many guided meditations, or so many, we have good living gurus we have, as Sir was sharing about his Isha Kriya experience. So you go to ashrama, you learn, you will do yoga, you take break from your work, you seek for a guru, and then once you start doing, you will develop your own technique. It is very difficult to stay in what phases it goes, but with practice only one can experience that. But still, to share with you, there are different stages like relaxation. Like when you sit for meditation, you initially start to relax all parts of your body, relax your muscles, you slow down your breaths, you relax your breath and every organ in your body. And then the concentration, like you can concentrate on the flow of breath, or you can chant Om. And then the stage of contemplation, looking at something and into deeply on myself, or my inner world, my values, on eternity, or on the true self. And the stage of realization, that is understanding and the feelings combined. You experience a more profound and more meaningful reality within. And then meditation, that is focusing on thoughts, which type of thoughts you are getting. You'll become aware of your own thoughts, and then you realize that your thoughts are coming down. Then you can get that reawakening, or a wonderful state of well-being. We'll also just go through what are the stress reduction strategies on which we can inculcate for the better work-life balance. So start your day with positivity. Just go out, you become one with the nature, you listen to the birds, you just imbibe some positive vibrations. Just when you walk out of the house early morning, you feel so good. Not doing anything, just walk, take a walk. It gives you so much of positive energies. You can plan your asanas, the Surya Namaskara, your pranayama, then the relaxation. And you can do it individually or in groups. If possible, do it in the morning. You'll find it very good. Or if you have busy schedules in the morning, you can also practice in the evening. But keep your stomach free, at least nil by mouth, at least of 4 hours, to have a better effects. If you have taken food, you take small quantities, and you can do the sitting asanas like that. But it's better to keep your stomach empty. Then effective time management. You have to prioritize, limit the time wasting activity and also people. So when you set the priorities, you realize that when you sit and think which things are avoidable, avoid those, so that your to-do list comes down. And then establish priorities, distinguish between the urgent, important, and unimportant. Identify which is most important. And these priorities change every year, a few years. Initially, we are on the work. That is our priority. Work and making money. Usually, first 8 to 10 years, everybody is running. Their priority is that. After that, children will be there next few years. So your priority changes. So that shifting of priority should happen. The family, children. Again, after the end of second decade, children are they are grown up and they are into this thing, and then you set different priorities. So like that, at different phase of your life, you set your priority and give your most to that part, and as much as possible balance everything, and ask yourself, what changes could I make to make my life easier? And have a mentor, discuss your problems with professional mentor you have, and also for your personal, you have a friend or family, discuss your issues. They will definitely help you. As I told, take off and learn from a guru. Eat healthy food. Take reassess your diet habits. You do in under moderation. Just assess that how much is, quantity and how often, that you can at least moderate whatever habits you are following, and take a break. Stay away from the professional work at least one day a week, at least Sundays. Just go out of the house on a drive or wherever, just any temple, wherever you feel good. Take your family and just every Sunday you should just go out with family and friends. Establish hobbies, diversion, and they counteract the undesirable effects of the stress. Can be anything. Nowadays, I see so many anesthesiologists doing photography. Every Sunday they are out. They have joined the cycling clubs. They are into marathon, and some are into music. Some are into, nowadays we are seeing a lot of karaoke singers among anesthesiology people. So like that, you take a hobby, you take out a day, or whenever you are free, just give time for your hobbies. And indulge in some sport if possible. That will definitely gives a very good fitness and also good kick when you laugh with your friends and play a sport. And you can also indulge in non-medical or voluntary activities. Do something for our society. Give back. Start giving back. That gives a higher level of satisfaction. You can involve in NGOs. You can involve in ashram activities or Lions Club, NSS. So many activities will be going on. You involve yourself in nearby temple activities. Anything, any religious place, mosque or whatever, any religious place, you can involve yourself and give back to the society and your community. That definitely gives a very higher level of satisfaction, and it also improves your leadership qualities. And at the workplace, we have to bring peace in the workplace. We cannot keep fighting because we come across so many people. We work with surgeons, we work with other physicians, we work with nurses and our subordinates, the postgraduates, our seniors, juniors, so many people. So you can't sit and fight. So you have to bring peace where you're working, and you just sit back, whenever you feel that conflict, just sit back and recognize the things that can be changed. And in general, you realize that the only person who can be changed is yourself. So concentrate on that, how I can change, how I can moderate my response or reaction to such stressors. Most of the times we overreact. So that is in us, that control is with us. So when you start inculcating the yoga and meditation, that aggression comes down by itself. You start, what they say, responding rather than reacting to any situation or people. So you control your aggression. Many times you see that when you're being firm, things get done. When you shout, most of the things will not work. They'll also walk away. But when you stay firm and you calm, and when you say a word, it will be followed, it will have an effect, it will be done. And also some of the I'm a perfectionist. That sort of feeling we have sometimes. Initially, I used to have this in the OT. Even I had issues with the way they fixed the IV cannula, like everything. So you start losing your temper. So sometimes you have to let go of perfectionism. It doesn't happen. Everything will not be able to do under perfection, under complete perfection. So sometimes you have to let go of that. You have to see the higher things, and we have to stop multitasking. We are more effective when we do one by one. When we start multitasking altogether, nothing will be done. It becomes a full confusion state. So start doing one by one. Then it will be more effective. In fact, it will be done very quickly also. And in your professional life, update yourself. Go to conferences, workshops. Nice workshops will be going on. Learn new things. Update yourself every few years. It definitely brings the professional kick in your life. And there are some meditation apps which you can use during workplace also. Whenever you are free, just sit for 5 or 10 minutes in the wherever there is place. Like usually I sit in the changing room or the tea lounge. Wherever you have place, just sit, just listen to some good things. There are so many apps for meditations nowadays. There are so many, guided meditations on YouTube. So you can just do that for 5 or 10 minutes. You'll really feel good whenever you are stressed at workplace or whenever you had a conflict with surgeon or somebody. At workplace, how we can bring these principles of yoga and meditation is you will become more aware. You will start pay attention to your alignment, your breath, your interactions with others. Then start bringing more mindfulness, that is being in the present moment or doing things with awareness. And surgeon is not our enemy. We have to work together, maintain good professional relationship. Humor, keep smiling, crack jokes. We have a session by Ganesh sir now after this. So definitely he'll bring light into this topic. And we have to unplug. Don't, get attached. Sometimes it happens. We get attached to so many things at the workplace or any place. Like sometimes we get attached to the patient. Sometimes we become attached to our work itself and our some students, and so many times. So do things with detachment. It is your duty, you are doing, do it correctly. Don't get attached to the things. So when you unplug yourself, things become more easy. And communication and assertiveness is very important. Learn to say no when it is appropriate. And you can say it in a good way also. When you're saying no, politely resist. It will be taken. You don't try to avoid the fights or conflicts. When we politely explain things, it will be followed. Doctors can neither be infallible nor superhuman. So when you're overstressed or you're overworked, you have completed your duty hours, explain that, and you can resist politely and come out. Then discuss major stressful areas and frustration with friends and family, colleagues. So definitely the work environment improves when you share your problems, what you're going through, what is happening. These many night duties I cannot do at this stage of my life. If you talk to your HOD, something will be done. Rather than when we fail to communicate, more issues happen. So communicate early when you're going through. Accept it that you're being stressed. No problem. Then you explain it. The people will definitely understand. And the good social environment, friends are important compensatory mechanisms in our lives. Among anesthesiologists, there's something called as problem of distorted thinking. Like sometimes we think that refusal of a case is implied to mean inadequacy, especially initial years of our practice. We think if I refuse a case, I may not be called again, or I may be considered as incompetent or something. Such thoughts come to juniors usually. So remember your positive experiences. If you seeking help is not at all abnormal, you should call for help. And at any stage of your life, whether you're junior, intermediate, senior, or end of your practice, any phase of life, calling for help is very good. It never means inadequacy. You are more prepared. You are you're reducing your own stress, you're sharing your stress with somebody else. So definitely seek help, call for help. Remember your positive experiences and do not jump to the conclusions. And do not magnify your mistakes and minimize successes. Avoid the emotional reasoning behind all such actions. Seeing oneself responsible for the external event. So many times we happen, I did this, that's why patient did not come out. I did this. So judge less. You on that point, what you felt was best, you have done. Like that, forgive yourself, forgive your students, forgive your people whom you are dealing with. When if something untowards happen, bad thing happens, so forgive yourself and improvise during next time. Sit back and analyze and take a action, improvise your next step. So start, judgment should be on a lesser side, action should be more on a higher side. Try to learn from the bad experiences and bring improvement. And we have to say certain simple positive affirmations to ourselves, that you are good, you're doing well in your life, you have a good future. You give positive affirmations to people you're working with. That itself changes your day. There's something called as traffic control. Sometimes whenever you get time or you're stressed, just sit for just 1 to 2 minutes. Take your name and say to yourself, relax. Like that. Take your name and say to yourself 3-4 times and take few deep breaths. It will help to channelize your thoughts. It just brings some amount of instant awareness. What is happening? How should I act next? And whatever answer you're seeking, that answer will come to you immediately. Within few minutes, what you are supposed to do. What you need to just calm yourself, sit back and just observe your breath and start thinking positive. Then good things will happen. When I was seeing for the literature, I came across this, that work-life balance, 10 things we wish would know, shared by the ASA, the website. So I just want to say what those people, those senior anesthesiologists have shared, like what would help if they had done it earlier. So they have said set your own scales. Everybody is on different, they're running on different tracks. So set your own scales, don't compare. Take time to exercise, expand your interests, look for opportunity to give back to your community, nurture your relationships, family and friends. Start investing early. We have a session by Sir now after the third session. Think beyond pay. Just keep some hobby and don't try to do it all. Hire people. I wanted to share this. We try to do everything by ourselves, but hire people, it definitely reduces your stress. So many times we are stressed because we have to go and drop our kids to Bharatanatyam class or whatever, some activity, we have to drop somebody. For that also we are stressed. So keep a driver. We all know that now at the certain years, like initially we all had very less pay. That time also we were happy. We were earning maybe 20,000, 30,000. We were leading quite good life. So we are maybe most of the people after 10, 15 years, they start earning 10 times of their first salary. So hire people. What I want to say is hire people. Nothing much is required to lead a routine life. Keep a driver, keep a cook, keep a maid, keep a gardener. If it's your hobby, you do when you're free, but keep a person for every work. Take help, because we have much more stress at the workplace. So when you have people who will help you, it definitely reduces the stress, especially during your busy schedule or your bad days, or you have a function at home, they'll be of great help. So hire people, assign the work to them, and learn from people. Keep books, update yourself, and what they say is reevaluate every 10 years. What are the priorities? So to conclude, anesthesia is a stressful profession. More than stress, it is burnout that constitutes a significant problem. Stress is unavoidable, but the good news is that stress, it largely rests on our own behavior. Stress is not caused by the situation we are in, but our reaction to situation. We can learn to control or moderate our reactions to stressors. We can curtail or eliminate most of the stress in our lives. Yoga and meditation improve physical, psychological well-being, and it helps us to emerge the 7 original qualities of any soul, that is purity, peace, love, happiness, knowledge, power, and bliss. Balance your work and life, establish priorities, communicate well, keep calm, let go of the perfectionism, be positive, stay detached, have a supportive family and friends. Inculcate the yoga and meditation in your daily routine for a healthier and happier life. Some of my references. So find 3 hobbies you love. 1 to make money, 1 to keep you in shape, and 1 to be creative. Thank you. Sir, any questions? Should we take now or when, sir?
Chaitanya, it is a very excellent presentation here.
Thank you, sir.
Rajesh here. Okay. I'll. Shiva is there. Shiva. I didn't find any questions from the chat box.
Yes,
but there is only one. There is only one comment from Edward, sir.
Yes, sir.
That you should write a book on this.
Yes, sir.
So you should write a book about this for the well-being of the for the well-being of all the colleague anesthetists.
Yes, sir.
But right now there is as of now I couldn't see any much questions. Edward sir, do you have any personal questions to Chaitanya sir?
Sorry, sir. I was not able to unmute. Now I am able to mute. Madam, wonderful presentation, madam.
Thank you, sir.
It gives knowledge about the life and work balance of your knowledge and your practice.
Thank you so much.
You have to write a book on this.
Sure, sir. Now you have told, I'll definitely write, sir.
Yes, thank you.
Yes,
thank
sir.
you
I never thought about it, but now I will write, sir.
Thank you so much. We are expecting it.
Yes, sir.
Over to you, sir.
Sir, Shiva wants to get unmuted, so.
Sir, I asked Silpa to make everybody unmute.
Okay, sir.
Sir, are you able to unmute?
Shiva, are you there, Shiva?
Yes, SIVAPRASATH, sir.
SIVAPRASATH, sir, are you able to unmute? Okay, not able to unmute.
Yeah, I think I'm unmuted, sir.
Yeah.
It's a nice presentation, ma'am. You covered all the aspects of, I think, whatever every anesthetist would go through. The tensions of life, surgeon, the patients, the money, and how our thoughts go, our own emotions go. You covered everything now. I would like to take a half minute and share my own experience.
Yes, sir. Yes.
And the time I joined anesthesia, my professor, the first word he told was, if you love your work, every day is a holiday. That went into me so deeply. I started loving anesthesia, but I didn't find that every day was a holiday. So the stress was building upon me for a long time. And there was physical stress, there's mental stress. And suddenly one day it started affecting me on my health also. So that is where I started spending time for yoga. And all my friends used to say that the time you do yoga, you can go for one more case and earn little more. But that is what is pursuing on yoga helped me to go and do what I liked. I liked subspecialty. I learned more on it. I could practice effectively, use time effectively. So ideally, whatever you said should be inculcated from the post-graduation period itself. And even MBBS should know. Postgraduates should learn it so that they can effectively use their time and energy to sail their life effectively and practice profession well, as well as lead a good, healthy family life and earn well, ma'am. Thank you very much. And as sir said, you should definitely write a book and also be a mentor for many postgraduates in many other institutions so that they know the amount of suicide stress is happening should not happen at all here afterwards. Nice presentation. Thank you very much, ma'am.
Thank you, sir. Thank you, sir.
Thank you, ma'am. Next, I invite Dr. Shantini to introduce Ganesh, sir.
Shantini, you are not audible.
I think she has to be unmuted.
She unmuted, but his audio is not.
Hello.
You are audible. No, madam, you are still not audible.
Hello.
Yes, madam.
Yes, madam. You are audible. Yeah.
Welcome to today's second session, Laughing Doses. I'm very happy to introduce Dr. Ganesh Choudhari, sir. He is working as consultant anesthesiologist in Sri Markandeya Solapur Sahakari Rugnalaya. He has started his drawing and cartooning hobby since childhood. He started drawing medical cartoons during his second MBBS. Now he has started under the name Laughing Doses, a cartoon page on Facebook, website www.laughingdoses.com, and also app on Android. His cartoons were purchased by Malaysian Medical Association Journal, Med India website, and About India Limited also. We are very happy to have you here, sir. Welcome to Online Anesthesia, sir. Over to you, sir.
Thank you. Very nice lecture by Dr. Chaitanya. It was really informative.
Thank you,
and
sir.
you really cover all points. Really, thanks for it.
Thank you, sir.
I thank you, Online Anesthesia, for giving me opportunity for presenting this Laughing Doses. This is my cartoon page on Facebook, Laughing Doses. So before we begin, disclaimer, all the character, incidences and places in these cartoons are fictitious. See, today we face medico-legal problem. I don't want to face cartoono medico-legal problem. So disclaimer is very important in today's time. We doctor run from home to hospital and from hospital to home. We should have some extracurricular activity, as Dr. Chaitanya said. It should be sport or music or painting or whatever it may be. We should have some extracurricular activity to reduce our stress. And for doctor moms, they are not only running in hospital, they are also running at home, doing all kinds of activity. First, I salute you, Dr. Moms. So first of all, many people ask me whether I myself do draw cartoons. Yes, I myself draw cartoons. Initially, I was drawing it by hand, but today all the cartoons you see, I drawn it on a Photoshop. Drawing is some time-taking job, but coloring is just a click job. On different layer, I draw different characters and it helped me easy. And advantage of technology is that once I draw anesthesia workstation, I don't need to draw it again and again. I just copy it and paste it wherever I require. So we'll start with first our internship. So here is a intern and consultant came for a round. Consultant notices some red marks over the patient. So he asks, is it a patient of bee sting? The patient say, no, it's an intern sting. He was just looking for a good IV cannula. So all you must have done this intern sting in your internship. If you deny it, you have not done your internship properly. I receive invitation for giving lecture on cartoons not only from anesthesia conference but also surgery, gynec, orthopedic and others. So for all of them, first I show cartoons on anesthesia and then I show them cartoon on their specialty. So if you can laugh on yourself, then only you have right to make a fun of others. So we'll start with anesthesiologist. This is anesthesiologist 2000 year back. During today, anesthetists carry anesthesia bag, but during that time they were carrying this instrument, the same instrument used for induction and top up. There was no reversal during that era. Then ether was invented, and newer anesthesia techniques like scope, drugs invented, and then come monitor. And when monitor came, anesthetists' hands become free and they started reading newspaper, novels, and then come mobile. But wait, I am not telling that the anesthetist is looking only at his mobile and he is not paying attention to the patient. I will show you his mobile. This is the iPhone of ideal anesthesiologist. There are multi-para monitor, ventilator settings are there, calculator for calculating doses and charges. Facebook and WhatsApp also there, but not for time pass, but for taking emergency second opinion from the colleagues. There is USG blooded blocks also, and games for keep himself awake during long duration boring operations. So this is the routine scene in operation theater. Once patient is handed over to surgeon, the lecturer anesthesiologist is teaching his resident, and he say, "Today I will tell you ABC of anesthesia. A for airway, B for breathing, and C, coffee," says the surgeon. See, surgeon is not concentrating on his surgery. Audible hai na vyavasthit? No. Now see, same cartoon has slightly modified into totally different cartoon. This lecturer anesthetist asks his resident, "How will you calculate the blood loss?" Now these residents are new, they are working day and night, they don't have a time to study. But one good thing about anesthesiologist is that they have a good observation power. So this new resident answer, "Blood loss is mild if only surgeon's gowns are blood-stained. It is moderate if OT floor is blood-stained, and severe if anesthetist also got a blood stain." So there will be many PG student watching this. Please don't tell this in your exam. See, anesthesiologist having difficult spinal, patient is not cooperative, multiple pricks are taken, patient become irritated. Are you giving spinal or doing acupuncture? Another case, obese patient is there, difficult spinal, already 4-5 pricks are taken, but direction of needle is still not proper. So anesthetist take out his mobile and looking the diagram of spinal. This is because of high dependence on Google Map for directions. This is typically freelancing anesthesiologist. Success of freelancer anesthetist depends upon how he manages his all surgeon, gynecologist, orthopedician, and blah blah blah. So let's see what he is doing with his 4-5 mobiles. Take the patient. I will be there in 5 minutes. And please don't call me after every half an hour. Now we'll go to the surgeons. This is surgeon 2000 year back. There was no shaving kit during that era. Then surgeons were properly cleaned, shaved, hygienic era it was. Then proper OT gown, mask, gloves. It was an aseptic era. And this is surgeon were looking like this before cautery was invented. And when cautery was invented, surgeon were looking like this. See, anesthesiologist is sleeping and surgeon is calling him. Wake up, anesthesiologist, you are already late. See, surgeon is very angry. Patient is painted and draped and anesthesiologist is late. He is running inside the operation theater. Angry surgeons say, "Hey anesthetist, you are late. I warned you not to take any other call during my operative time." The poor anesthetist say, "It was nature's." See, some calls cannot be forwarded. Laparotomy was going on under regional anesthesia and bowels were coming in the field. So surgeons say, "Give me head low." Anesthetists say, no, respiratory compromise. I will not give head low." Surgeons say, "I am not able to work. Give me head low." Anesthetist, "No, cardiac compromise. I can't give head low." The surgeon become irritated. "If you don't give me head low, I will not able to finish surgery on time and you will miss your next case." Anesthetist say, "You want head low or Shirshasana position? Tell me, I will give it." Now this is gynec. Sometimes I want to tell them, don't work hard. Work with intelligence. Just show the mobile that the baby will definitely come out by itself. This is a scene in gynec OT. Cesarean section was about to start. You remember anesthesiologists always have a fighting with this gynec. Why? Because anesthesiologist has a whole day schedule, and when immediately some fetal distress come and his whole schedule is disturbed, he has to leave everything aside and run for that Caesar. And sometimes it came to know that it was not so much fetal distress. So quarrels and fightings are common with gynecologists. So one day what happened, there was a huge argument between them, and anesthetists say, "I am not giving fundal pressure. That is not my job." So next day, what happened, when spinal given and patient handed over to gynec, and bodybuilder man come inside OT, and the gynec say, "My dear anesthesiologist, we had argument during last cesarean section, but don't worry. I called him only to give fundal pressure. As you said, it's not your job." Now see, when inexperienced person give fundal pressure, "Oh my God, you gave fundal pressure so forcefully, baby delivered vaginally." एनेस्थेटिस्ट के साथ पंगा नहीं लेने का. Anesthetist wedding was there. Bride came with wedding dress and anesthetist come in the OT dress. So the bride was confused. "Darling, is it your wedding dress?" The anesthetist say, "No, it was fetal distress cesarean section call and all other anesthetists were busy." When the other anesthesiologist who came there to attend wedding, they came there and they said, "Dude, we all anesthetists were here only. When call came, we said we were busy and you went for that call. Because bride was very angry for that. CPR training program is going on. The male doctor is doing CPR with heel of palm, which is done in adult CPR, and lady is doing with 2 finger. So he say, in adult CPR is done this way. What you are doing is done in infant CPR. The lady say, yes, you are right. But being a gynecologist, this 2 finger technique is more comfortable for me. Now we'll go in orthopedic OT. This is routine seen in orthopedic OT. Patient after giving spinal, they will take 1 hour in positioning, 1 hour in painting, 1 hour in draping, and when spinal levels start receding, they will take incision. This is routine seen in orthopedic OT. The anesthesiologist tried to change it over a period, but he gave up. So now he just settled the patient and started reading the book. And he came across one news. Congratulations, Dr. Ortho. You got family planning award from government. Dr. Ortho say, why me? Siam technician knows the answer. For doing painless and sutureless sterilization with heavy shots of X-ray. In orthopedic OT, we wear this heavy lead gown and assistant come with funny dress. Hey assistant, what are you wearing? The assistant say, these lead gowns are very heavy and uncomfortable. So I made this comfortable design. Anyone copying this design patent is with me, please. So you remember Maggie was detected with higher lead content. So this was the lead gown. If you have a shortage of lead gown, proper lead gown in OT, and if you are eating Maggie since your childhood, you don't need lead apron. Special cake was made for Dr. Ortho, but sir, why are you not cutting the cake? Anesthetist knows the answer. He is waiting for Siam. A PT lady enter inside operation theater and anesthetist quickly diagnose she must be girlfriend of Dr. Ortho, and nurse comes to know where are the missing prostheses. Tibia fracture under spinal is going on, and this enthusiastic Dr. Ortho showing the patient his tibial implant. This is the implant for your fracture bone. The lady immediately say, first show me more designs and colors. Now urosurgery. TURP is going on. This is routine seen in TURP OT. Look at the anesthesiologist. He is prepared for the worst situation. Look at the innovative breathing circuit attached to the patient. So we are prepared for the worst. And surgeon is saying, I want more irrigation. Le bhai le, jitna irrigation chahiye le. Why not to build up a glycine tank over the operation theater? Special cake was made for neurosurgeon. Happy birthday, neurosurgeon. Looking at that cake, neurosurgeon is thinking, thank God I am not a urosurgeon or gynecologist. Now we'll go in ICU. this new fat intensivist has joined ICU, and first time they are taking handover in the ICU. So this older thin intensivist introducing him to the patient. This is the new intensivist, and he will take care of you from now. That cachexia patient looking at that fat intensivist and imagining what will happen if he needs CPR. He immediately said, "Doctor, I want to sign do not resuscitate form." See, as a doctor and also our paramedical person, miss the festivals. Let it be Diwali, Christmas, New Year, or a Holi. Not only we, our paramedicals also miss it. So there was a Holi holiday, and emergency case came, and all other, including these two assistant, came to OT. They were not happy because they haven't got a chance to play Holi. So they play Holi inside operation theater, and surgeon become very angry. "You played Holi inside the operation theater." The smart assistant say, "It was just accidental spillage of betadine, spirit, POP powder and methylene blue. We haven't played Holi." Now in the selfie era, patients say, "Doctor, this is first time in operation theater. Can I take a selfie?" Surgeons say, "Why not? I also want to take selfie. Mine also first time." Patient wanted selfie during spinal. Anesthetist say, "Okay, I will bring this high definition spinal needle. Now take a selfie." Laparotomy was going on under regional anesthesia, and when boils were outside, patients say, "Doctor, I want brave heart selfie with open abdomen." The irritated surgeons say, "For real brave heart selfie, put this intestine around your neck and take a selfie." Now everything is over, case is over, but the patient is not coming out of anesthesia. All things are checked like CBC, electrolytes, blood sugar, everything is checked. All other means are tried, but still patient is not coming out of, this lady is not coming out of anesthesia. So anesthetist got an idea. He shout, "Sale, sale, sale, 50% off." And the lady immediately came to consciousness. Now see, same scenario happened, and this guy is not coming out of anesthesia. Remember, our teacher tell us every case is different. So we, for case, in case of that lady, we shouted sale, sale, 50% off. If I shout sale, sale in this case, instead of coming out of anesthesia, he will go deeper in anesthesia. So for every patient, we should have a different strategy. So anesthetist shouted, "Wow, it's Sunny Leone is here." And patient came to consciousness immediately. Now, anybody has any question, not understood any cartoon like that, can call me afterwards to show your brain to me. I will show you two videos. I think also. आता
आजा रे आजा अरे एक को और तीन चार संग पाँच छः सात है वाला। अरे एक को और तीन चार संग पाँच छः सात है वाला।
This is the logo of our ISA, Indian Society of Anaesthesiologists. Just a 1-minute video to explain the meaning of this logo. Thanks a lot.
Thank you so much, sir. Shantini, madam.
Thank you very much, sir. Actually, I started noting down my favorite slides, but it came around every slide I had to note down. So everything was superb. I enjoyed especially the labor auto jokes and the head low abdomen surgeries and the regional. Thank you very much, sir.
Thank you.
Next, I welcome Dr. KARTHIK.K sir to introduce Dr. Kumaresh sir.
Dr. Ganesh sir, I could not control laugh for the past 30 minutes. I could not open my video for all the time. I have to stop the video in between.
Yeah, thank you, sir. Thank you.
Are you listening to the academic lecture or why are you laughing for the past 30 minutes? Very nice.
Thank you.
Karthik sir.
Yes, sir. Am I audible?
Yes, sir.
Good morning, respected seniors and other fellow members of this community. Special thanks to the pillars of this community, Dr. Edward sir, Dr. Rajesh sir, SIVAPRASATH sir, and other doctors. After a great relaxing session from Dr. Chaitanya ma'am and a good laughing doses from Dr. Ganesh sir, now we are moving on to the finance. Finance in itself is a gray area for most of the common people, including doctors. We know how to, earn the money, but we don't know how to grow the money. So the financial freedom is having enough residual income to cover your living expenses. It is not about being rich and having tons of money, but having enough to cover your expenses so that you can spend your precious time doing what you like. So our second topic is about evidence-based money management. So I'd like to call Dr. Kumaresh sir. Dr. Kumaresh sir did MBBS from Chengalpattu Medical College and MD from Madurai Medical College, and he also finished lab and got trained in the UK. And apart from academics, he's now he's now mentoring financial literacy in many forums and guiding doctors to achieve the financial independence. Currently, sir is now pursuing 2 degrees related to the finance, like Certified Financial Planner and CPEP. Warm welcome, sir. Over to you, sir. We can start the session.
Thank you, Karthik, sir. Good morning, all. At the outset, I thank everyone for giving me this opportunity. Without much ado, we will go on with the topic. From school to college to conference to CMEs, we'll learn how to make money or work for more money. Today, we are going to see how to make the money go to work for you. And I don't need any disclaimer because all these are my personal investments and insurance policies. And I don't take pride that this money management need to take this approach only. But it can be done like this also. This is the only message I want to convey to this group. Financial planning starts with first wealth protection, then multiplication, finally divide our wealth to the next generation. Dividing our wealth to the next generation is entirely big topic and needs minimum 1 hour of discussion. Today we are going to focus mainly on protection and multiplication. With regard to wealth, there are 2 risks in life. Risk of living too long is also a risk because for that we need to plan retirement pension planning. Because most of the freelancers are those who are joined in government service after January 1, 2004 has got no pension at all. So we have to plan for that. Then risk of living too short is also a risk because we have got financial dependent spouse or kids. So for that risk of living too short, we have got a wonderful tool that is known as life insurance. Who needs life insurance? We should not be emotional on insurance and investments. The life insurance should be taken only for breadwinners of the family. We should not take life insurance in the name of non-earning spouse or non-earning kids. Because if their life is at loss, there is only emotional loss, there is no financial loss for that family. So only the breadwinners has to take life insurance. How long needed? Because in some of the insurance advisory will tell, in our company we have got 100 years, 90 years. We got confused. How long we need to take? We need to take only till there is financial dependence. For example, when I planned, I had got 11-year-old son and 6-year-old daughter. My wife is a doctor, she's a child psychiatrist. So she doesn't depend on me. So my financial dependence gets over in next 20 years. Because my son will be 31 and my daughter will be 26. They might have completed the education and they might have got married at that time. So I need to take life insurance for next 20 years. How much sum we should need? For that, we have to have this human life value. Suppose my annual income is 10 lakhs per annum and my financial dependence is there for 20 years, then I need to take life insurance for 200 lakhs or 2 crores. So this is my human life value on that day when I took the life insurance policy in 2016. So I have to take 2 crores for life insurance policy. This is again mine. I have taken for 2 crore life insurance policy. I need to take policy term for 20 years. I took for 20 years. So because life insurance accidents are common and the anesthetist has to run here and there, the chance of accidents is more and disability is there. So I have insured myself for another 2 crores for accidental and disability. So what's the premium? 42,000 plus GST. That comes around 48,000 rupees per annum or 4,000 rupees per month. Next, our wealth is destroyed only in our health related activities. What I suggest is to take minimum 10 lakh policy and professional indemnity policy. What I suggest is to take only 10 lakh policy, but I have took policy for 80 lakhs for my family, entire family, because life insurance should be taken only for the breadwinning members. But life insurance should be taken for all the family members. Why this much sum assured is needed? Because if 4 of the family members going in a car met with a major accident, then polytrauma means ventilator, multiple surgeries, all those things will go, and per head the cost maybe go around 20-25 lakhs. For 4 member, 1 crore. We don't have 1 crore in our pocket or SB account. So what happened? Our relatives will spend all those things from their pocket, or they will get interest for that interest. For 1 crore, the interest minimum will be 1 lakh rupees per month. How can I close that 1 crore loan? So my family will be in soup. So wealth is protected only in health-related activities. When I talked to some of my oncology friends, they told that interference have come 2 lakh rupees injection per week for next 1.5 years for some of the cancer surgeries. So this much amount is needed to avoid wealth destruction in our family. What is the cost? If you take 5 lakh, 10 lakh policy, the premium will be around 18 to 20,000 rupees. But you take this big policy, the premium is relatively smaller, 36,000 per annum including tax. So 3,000 rupees per month. So 4,000 rupees for life insurance and 3,000 rupees for medical policy, my mental peace is guaranteed. So next, all the anesthetists should have minimum 1 crore of personal indemnity policy, because another wealth destroyer is going to be this only. So the cost is comfortably less for 1 crore 8,000 plus GST only. This is about wealth protection. Now we are going to multiplication part. Let us define investment. If we invest in one instrument, we are going to get returns. For that returns, we have to pay tax. So our returns will get decreased. So post-tax return of any investment should be at least 1% above inflation. For the past 40 years, inflation in India is approximately 7%. My son asked, what is inflation? I told him, we are going for a grocery shop, going to buy 1 kg of rice. The cost of 1 kg of rice today is 100 rupees. We are going to buy the same quality rice next year in the same shop. The price is 107 rupees per kg. That is, the 100 rupees has increased by 7%. So 107 rupees per kg. It has increased by 7%. So what are all the asset class in the world? We know fixed deposits are bond, gold, real estate, shares are equities. We have to know that if you get as interest income, it is fully taxable. We all are more than 10 lakh per annum income. So anything if we get as interest, that is 30% tax. Interest is not taxable only in public provident fund as Suganya Samriddhi scheme, tax-free bonds held till maturity. Other than that, all interest are taxable, 30% for us. In public provident fund as Suganya Samriddhi scheme, 1.5 lakhs per annum only is allowed. So let us see fixed deposits. Suppose we are investing 100 rupees in fixed deposits, interest rate 8 rupees means we are going to get 8 rupees interest. For this interest, we have to pay 30% tax. So after tax, post-tax return is 5 rupees 50-60 paise. After 1 year, we are going to get the principal back and the net 5 rupees 60 paise. And now I have got 105 rupees 60 paise in my hand. If I take this 105 rupees 60 paise in my hand and go to the grocery shop, then 1 kg of rice is 107 rupees, which was 100 rupees last year. Now the price is 107 rupees. We can't get the same 1 kg of rice what we got for 100 rupees last year. And we think we are multiplying in fixed deposits. Is it true? No. So fixed deposits is not an investment at all. Fixed deposit is not an investment at all. Public provident fund interest is tax-free. So it gives 8% interest means it comes under the category of investments because it's beat inflation. What about gold? See, daily we think the price increases day by day, but this is the fast 10 years data of 24 karat gold. Since from 2013 to 2019 June, the gold price was the same. So the returns was 0% returns we have got. Or in between, if we have sold means we have sold in negative returns. After June 2019, the price shooted up. Then it came down 20%. Then again going up, Ukraine war, like that. Gold is also a volatile asset. And we think that gold price is increasing day by day. Regarding gold, I want to share one real life story. One OG madam, young OG madam, she was calling another senior OG madam for cesarean sections in 2004-5. The young OG madam was showing the senior OG madam the beautiful gold ornaments jersey bought for her daughter's marriage. That's going to happen 15 years. And she also told me that she has bought a land for her daughter's marriage. I thought, oh, what a beautiful plan it is. I was going to that madam for next 15 years, 2017-18 came, marriage age of that OG madam's daughter came. The man was very sad. I asked, why madam, your plan was good. What happened? Told her, there is no money. Why ma'am? Sold the land that you earmarked for marriage. Sell it. She told, no, SAR is not allowing it. Okay, leave it. Already I've got sufficient gold. No, my daughter is telling that the design is not either antique or latest, it is old. That means what? That means what? Already we have paid wastage and making charges at the time of making the ornaments in 2003-4. Now we are going to give another wastage and another making charges. Already 25% gone, now another 25% gone, 50% gone. So we think gold is a good investment, but in real life, it's not. We think big about real estate. My grandfather bought it for 3 lakhs, now it is 3 crores. If you have bought real estate in 1988 and sold in 1995, amazing returns. If you have bought in real estate in 2001-2 and sold it in 2010-12, amazing returns. But you have bought in 1988, selling in 2023, average returns. The Investopedia says the average 20 years return of average real estate returns only 9.5% throughout the world. And we have done calculation for more than 500 properties. It's around that except 2 or 3 properties. So for apple to apple comparison, we have to convert the absolute numbers into percentage. We should not talk in terms of absolute returns. Like 3 lakhs has become 3 crores 100 times in 40 years. No, convert into percentage for apple to apple comparison. And we should know the disadvantage of real estate also. Large amount is blocked. It is illiquid. Sometimes I need only 25 lakh rupees. I can't sell the hall. Fake documents, land is grabbing, encumbrances, dividing into legal heads. Next generation also very difficult. We have to pay the long-term capital gains. Can we buy flat? Building is a depreciating assets. Because we may, if we are having hospital means we are getting depreciation for that hospital. And land is only appreciating. If you have got 1,500 square feet of flat, then our undivided share may be around 600, 625 square foot only. When I asked many people, what's the cost of your flat? They told 1 crore. They might not have taken into consideration of registration 4%, stamp paper 7%, brokerage 1 to 2. The cost of that flat becomes 1.12 crores. Have they bought the entire 1.12 crores and bought the flat? No. They might have got loan. We have to add interest part also. What's the rental yield? 1 to 2% for domestic properties for rental and for commercial properties 2 to 3% throughout the world. And there are too many issues like drainage, water tax, maintenance charges, all those issues are there. So For the past 40 years, inflation is approximately 7%. Fixed deposit has given 8, gold has given 9.5, and Sensex has given 16%. We all know Sensex is nothing but India's top 30 companies, Reliance, Infosys, ICICI Bank, HDFC Bank, all those things. It has given 16%. And this data doesn't so amazing. If you put 100 rupees 40 years back in fixed deposit and 100 rupees in gold, 100 rupees in Sensex, we can come to a conclusion. So 100 rupees in fixed deposit in 8 years, it has become 2100. That means it's multiplied by 21 times. And gold, superb, 37 times. And if I put in Sensex, it is 378 times. In fixed deposit, 8% means 21 times. In 16%, it has to become 42 times now. How come it becomes 378 times? And we have to say whether it has given 16% or not, Sensex. First, we see it is because of compound interest. Compound interest is nothing but interest on interest. And Einstein says compound interest is the eighth wonder of the world. He who understands the compound interest earns it. Simple interest formula is simple and compound interest formula is complex. That's why this is the wealth creation formula and we don't know this. See, when the time increases, when the percentage increases, it's multiplying in square root, triple, it is multiplies. That's why it's the wealth creation formula, compound interest. Einstein had told. 40 years back, Sensex has started with 100. If it is 378, that is, it is 16%. What is the Sensex today? Let us ask Google. It is 698 times. More than that. So we talk about real estate 100 times in 40 years. But it is 700 times in 40 years. Where the wealth is created? In share market. But why don't we invest in share market? Because of the breaking news and bad news in TVs. Bloodbath in share market. 7 lakh crore wiped out in a day. We have not invested. We thought that our money has gone. Whether it has happened? Yes, it has happened in 1992. Even though this looks small, the fall was 50%. In 2000, dot-com bust, the fall looks small, but it's 50%. In 2008, the global financial crisis, the fall was 60%. During Corona, the fall was 40%. We all are anesthetists. We are taking cases. Do we have cardiac arrest patients? Yes. Yes. If there is cardiac arrest, we should not take risk for the patient and we should not go for cases. We should see whether the cardiac arrest is revived or not. That is more important. So we must see for how many days it took take the Sensex to recover to the same level. In 1992, it took only 473 days. In 2008, it took only 660 days, 1.5 years. During Corona period, it took only 6 to 7 months. So cardiac arrest is not the big problem. Recovering the cardiac arrest, that is the result we should know. So for the past 40 years, fixed deposit has given 21 times, gold has given multiplied our wealth by 37 times and Sensex by 700 times. So wealth is created share market. Shall we go to buy in shares? Yes, I started in 2003-4. I started Demat account, read all the things, price to equity, price to book, price trading growth, return on capital applied, tried to read the balance sheet. And for my head, everything went on well. No. Because I am a doctor. I could not read all those things. I miserably failed. So I started giving money to mutual funds, where a qualified fund manager is there to taking care of the shares, like patient taken care by doctors. These fund managers read about this company balance sheets and start investing. The term we tell about mutual funds immediately that comes into mind is mutual funds are subject to market risk. It is like informed consent for surgery and anesthesia. I am a renal transplant anesthetist for the past 20 years. You all know the commonest cause of renal failure is diabetes. If diabetes is there, hypertension, left ventricular hypertrophy, coronary artery disease, congestive cardiac failure, urea creatinine elevated, electrolyte imbalance, and anemia. With all these things, if I want to, I have to get informed consent from the relatives. Like arrhythmias, cardiac failure, arrest. If even after I'm telling these complications, the attendants will ask me, there is no problem at all, no? They will ask us. So there is no risk-free investment in the world. Even fixed deposits are not risk-free. It is insured for only up to 5 lakhs by Deposit Insurance and Credit Guarantee Corporation of India, not by the bank, not by the RBI. So there is no risk-free investment in the world. How to tide over this crisis is very simple in share market. You time. We have to wait for 160, 1.5 years to get to the same level. After that, it's going to increase only. Because we all know that India's growth story. Now we are $4 trillion economy. We are going to go to $5 trillion economy very soon in next 3 or 4 years, whatever it may be. So India is the growth story in the world. If you want to be the part of growth story, we must invest in share market. That's the economic mirror of India. So advantages are professional management, liquidity, low cost, transparent, well-regulated SEGI. According to our risk, we can construct our portfolio. Whenever we talk about mutual funds, it is not only invest in equity or shares, it is debt or invest in bonds. Mixture of equity and debt is hybrid. See, in one time, when I took the investments were minus, but it is only 230 days old. But if you say in long term, 10 years, 1 lakh has become 5 lakh. If you want to ask me what is there in long term, before that, see this 2006, I bought it for 10 rupees, Franklin India Smaller Companies Fund. During 2008, it went to 12. After that, 60% crash was there. So it went to 5 rupees. What could be the cost of that Franklin India Smaller Companies Fund today? Let us ask Google. It is 156. See, if you invested 10 lakh rupees, it has multiplied by 15 times. But if you invested in 2010, you might have got 30%. If this thing was going on, offer sale or 50% discount sale was going on during market fall. If you have bought but that time, then it has multiplied our wealth by 30 times. So that's why even though it's showing minus, I am investing still in this fund. What is the taxation aspect? If you work hard, we have to pay 30% tax. But in equity mutual funds, for short term, if there is loss, there is no need to pay tax. And we can compensate that in next year, 8 years, we set off. But if there is gain, we have to pay only 15% tax. If it is long term, means only 10% tax. If you work hard, I have to pay 30% tax. If it is passive income, only 10% tax. In debt mutual fund, it is as per the tax law. What are the alternative to fixed deposits is debt mutual funds. It's a tax efficient or tax deferment. You can withdraw at any time, no TDS at all. We strongly believe LICs. Where do they invest their money? Our money. It is invested in government bonds, corporate bonds, treasury bills, commercial bills. And debt mutual funds investing in the same product or same bonds. So if you believe LIC, then we can invest in debt mutual funds also. So these are some of my invest in debt mutual funds. So what is investment? It should beat inflation. Post-tax return of any investment should beat inflation. So fixed deposits is not an investment at all. And gold just beats inflation. Real estate gives 9 to 10% returns. And Sensex gives 16% return. We have seen about investment and insurance. What we are going to do is financial planning. Because I don't know anything about markets, but I have planned. Warren Buffett says, idiot with a plan can beat a genius without plan. So we put a case sheet like this. So name, age, income from other sources, right? Rental income, agriculture income, monthly expense, income minus expense is savings. What are all the current loans? What are all the policies that you have? Whether we have got PPF or not. PPF is very important. During Corona period, first time my wife asked me, see, my friends have done so many things for pension plan. What we have done? She asked me, wow, very nice question you asked to me. I showed her PPF passbook of both of us. For the past 15 years, we were investing in PPF. So the amount now generated is 50 lakhs in both the accounts. The percentage of interest in PPF is 7.2%. For 1 crore, we are going to get 7.2 lakh per annum. So we have got 50 lakh rupees in PPF passbook. That means we are getting 3.6 lakhs per annum interest, tax-free interest. That means every month we are getting 30,000 per month, even now. In 2020 March, I told my wife. In 2020 March, even though I am a freelancer, I am getting 30,000 pension, tax-free. Then what? We should ask ATC, what are all things that we are showing? And if there is fall in market, then their money value will go down. So if you feel sad, if you lose sleep, then please don't invest in share market. Because after educating, we must get educated and we have to know how to tide over the risk. Rather than avoiding risk is not intelligent at all. We have to tide over the risk. That's why we are reading or studying all those things. So emergency fund is there or not. Again, this case sheet was written in 2016. We don't know about Corona. But 6 months of our monthly expenses should be there in emergency. During Corona, what happened? Lockdown. No anesthesia practice for me because I do only elective cases. No anesthesia elective cases means every elective case is gone. And my wife is a child psychiatrist, elective case, so we have got zero income. My wife told, oh, what we are going to do? Then I told 6 months of our monthly expenses and hospital expenses we have kept as emergency fund. So even if there is lockdown for next 6 months, we no need to worry. These 6 months I have prepared because if I met with an accident, then it will take minimum 6 months to recover from ortho procedures. That's why 6 months of our monthly expense should be there in emergency fund. Other terms and medical claim and professional indemnity, then we will go for a proper financial planning. What a person needs in your life: car, house, kids, education, marriage, and retirement. It comes in which year? What amount needed at present? Because of inflation, what's the amount that is needed because of inflation? And what's the solution? This is the problem. So this is my daughter's marriage planning calculator. I told you now that my daughter was 6 years old and expected year of marriage is 26. Marriage expense is 20 lakhs. Expected inflation put higher, 7.5. We are going to decreasing our expense 1%. Sensex has given 16, no? We are putting it 15%. If we calculate, the current marriage expense of 20 lakh is 88 lakh after 20 years because of inflation. 88 lakhs is a big amount to create suddenly. It is like a goal in cell phone top. And 20 years means 240 months are there. It is like steps, cell phone tower steps to reach the goal in 240 months. If I invest 6,000 rupees per month, this calculator is telling I can reach this goal. Suppose I am investing 6,000 rupees per month, and if it gives 15% returns, I can reach the corpus of 88 lakh rupees. This is what this calculator is telling. We are more worried about the market volatility up and down daily. If our aim is gold, not the markets. So, irrespective of the market condition, I am going to invest 6,000 rupees per month. We are emotional on insurance and investment. So, to break that emotions, we have got a beautiful tool that is known as systematic investment plan, SIP. Irrespective of the market condition, every month on 10, 6,000 rupees will go in a fund for my daughter's marriage. If I do this for next 20 years, I can reach the goal. So my aim is daughter's marriage, not the market volatility in between. So I'm keeping aside 6,000 rupees for my daughter marriage. And I calculate the same for my son. It came around 3,000 rupees. And this is my retirement pension planning calculator. And I plan I was 45-year-old and 50,000 rupees per month, my expense. Expected inflation is 7.5. Pre-retirement, I will invest in equities. And post-retirement, I don't want to invest in take risk, 8% in debt market. I will keep that every corpus in debt funds. That means current monthly expense of 50,000 rupees will be 2.38 lakh per month after 20 years because of inflation. To create a car, to get 2.38 lakh per month as interest, I need to create 4.14 crores. To create a corpus of 4.14 crores after 20 years, I need to do 24,000 SIP. That means if I invest 24,000 rupees per month for next 240 months, and if it gives 50% and can create a corpus of 4.14 crores, from the corpus I can generate 2.38 lakh per month as interest. I can live peacefully as pension. This is the pension plan. So I was earning 1 lakh per month. The income tax is 10,000 rupees. My monthly expense is 50,000. For retirement, I'm keeping as 24,000. For life insurance, 4,000. For medical insurance, 3,000. For my daughter's marriage and son's marriage. If you add all these things, it will come to 1 lakh rupees. Idiot with a plan can beat a genius without plan. So I planned like this. So I stopped going for night cases since 2004. I work only between 9 to 6 on my terms. You can ask what do you do for education, foreign trip, car. My wife is also earning 1 lakh. Except 10,000 rupees income tax, 90,000 is there. So if you properly plan, then we can do wonders. I reached the corpus of my retirement, so I call myself as financially free. Now I am working because I want to, not because I have to. That's why I call myself as financially free anesthesiologist. I am on a mission to educate, inspire, empower 1 lakh doctors to attain their financial freedom. For that, as ma'am told, I have got 5 employees under me to help because we can't do everything on our own. You can ask, is it guarantee? There is no guarantee in life, health or wealth. Be aware, be knowledgeable, be disciplined. That's the best one can do. So, post-tax return should beat inflation and taxes. Don't mix insurance and investments. Fixed deposits are not investment at all. If you are going to change your car after 3 years, don't invest in equities. Invest in debt mutual fund because your goal is only in 3 years. If your kids' education coming in 5 years, between 4 to 5 years means invest in hybrid mutual funds. If your goal is more than 8 years, then invest in equity mutual funds. And thank you very much for giving me the wonderful opportunity, and happy to answer all your queries. Thank you, sir.
Thank you, sir. Thank you very much for the wonderful presentation. Over to Karthik.
Sir, it's a very insightful information, sir.
Thank you, sir.
I just want to ask a few questions. Firstly, what are all the basic things one has to do before start investing? The basic mandatory things before start investing, because you said no, the markets are subject to, the mutual funds are subject to market risk. So we need to ensure the basic things like emergency fund and insurance and all. So can you brief something about that, sir?
Wealth protection, term insurance, mediclaim policy, professional indemnity, it's a must. First, this protection is very important before multiplication. Then emergency fund. Then PPF. Then gold-based investing. Fixed deposit is not investment at all. If you have these 5-6 points in mind, then you will go in right track. I don't think this is the way to go, but finance can be approached like this also. Because no need to run 24 into 7 into 365. If you earn 1 lakh means per day 3,333 rupees only. If you go one case alone, that's more than enough. That's more than enough. No need to run for 24 into 7 into 365 at all. Because of the financial mistakes, we are working. We should not work for money. Money should work for us.
Absolutely, sir. Your opinion about the home loan, sir? Anything home loan? For example, I just give you a scenario. For example, if someone has taken a home loan of say for 1 crore for 20 lakhs, is there any ways to finish it off early?
There are many ways. But financial intelligence is using other people money, other people time, other people money, other people knowledge, other people everything, other people. So financial literacy is you can get 12% in equities, and your home loan is 8% around. So why we need to close that loan, home loan? 20-year loan, let it go. Invest in equities. Invest in equities. There is a 4% arbitrage there. It's very huge. Because this is not today's topic, we can connect or in some other day also. It is using other people money. We should not close home loan at all, because we are going to get 12 rupees and we are going to spend 8 rupees. 4 rupees anyway we are going to gain. We should not be emotional.
Compounds.
Net debt free is the middle class mindset, and net debt free is the rich mindset. Our mindset is middle class mindset. So that's why we should be debt free. Like that, we are telling to ourselves. If you are paying EMI, the bank is not going to do anything to you. Why we should close? Anyway, the term insurance is there. If something happens, that will take care. So, or if you are worried, scared, take another loan insurance. But I strongly against taking home loan insurance. I ask you to increase the term insurance.
Okay.
So these things are not taught, or to whom to ask, we don't know. That's why I'm very much interested in learning all those things. And please don't close your home loan. Let it be there for 20 years. Invest in equities according to goal-based. Live peacefully.
Okay.
Happily. Using other people's money.
Third question, sir.
Yes, sir.
Yeah, sure, sir. Sure. The third question, sir. What about you have said about the gold? Can you throw some lights about SGB, sir, sovereign gold bonds, or any minimal amount of gold which we should accumulate over the certain period?
Yes. See, we have seen why we need gold. If daughter's marriage is after 8 years, then sovereign gold bond is good. Physical gold, chance of theft, all those things are there. A small allocation to gold of 10% is excellent, because if share market falls, the gold price will go up, inversely proportional. Dollars is inversely proportional to gold. So I don't want to talk about this economy. If you have got proper asset allocation to gold, only 10%, you restrict yourself, then we can make huge money. Huge money. I'm 50-year-old. I have got my own pension credit. As I told, I have created my own pension plan. I don't depend on anyone. So that gives confidence on me. So that confidence I want to inculcate to all the assets mind. So that they should not work for money. They should work on their terms. They should work. If they want to go to that case only, they should go. Otherwise, daily they are going to run for cases 24 into 7 into 365. it's not going to make them rich at all, because you have to pay 30% tax for the hard work you are going to done.
Okay, Ganesh, so Chaudhary wants to ask some questions.
Yeah.
Ganesh, sir, please.
Hello. Sir, have you suggested personal accidental insurance?
Yes, that's what I told you, no? That personal accident with disability insurance.
Yes, with disability. Yes,
Yeah.
yes, yes.
Yes. So accident and disability insurance is a must. I met with the accident and I become disabled right hand. How can I go for cases?
Yes, yes, yes. Yeah,
So
that's
disability insurance also included. Yes, sir.
And one thing,
protection is important first.
Yes.
Instead of multiplication, protection is very important.
Yes, yes. And one thing about the PPF I want to add, like PPF has got a special immunity. If suppose something happens, patient sues us, and or any other reason, there is a zapti, we say, from the court. There can be takeover for all other properties, but they cannot touch PPF. This is
Yes,
a one
sir.
pointer.
Absolutely correct, sir. It is immune from attaching. And if the life insurance should be taken under Married Women Protection Act, MWP Act, that also takes immune. And we have talked about wealth protection and wealth multiplication. We have not talked about wealth transfer and how to protect our wealth by wills and trust. And this is another interesting topic I used to talk about on estate transfer planning. And it is there in YouTube also. Estate transfer planning, I discussed about this in ISA webinars. And the third part is how I retired rich and what I am doing after retirement. This is retire rich topic. Again, that I discussed in ISA webinar. You can watch in YouTube videos. YouTube video, it's there. How to do retirement packet strategy and how to plan for my kids. I have planned for my kids also, not only for me, because if I want to retire, my father and mother should not depend on me. I should not depend on anyone. And my kids should not depend on me. So 3 generations planning is needed. So I have done 3 generation planning. So next, I am retired. I have plans to get retired for my kids also. That is financial freedom. That gives immense peace of mind to do whatever you want. Yoga, meditation, wherever you want to. Yeah, amazing. It is there in ISA webinar videos, sir. Yeah, financial advisory webinars. If you can connect me, I will send the video link. Yeah, those who want it.
Thank you,
Yeah.
sir.
Thank you, sir.
Sir, one more final question.
Yeah.
What is your advice for the parents who are having girl child in related to the finance, creating a great corpus for any education, career, and marriage?
Yes, we have to plan like that only, you know. We have seen that for car or home, for kids' education, kids' marriage, goal-based investing. Do goal-based investing. What's the expense today? What is going to happen because of inflation? What I am going to invest today? We have that's financial planning. Plan like that. That is financial planning.
Okay.
That depends, varies from individual to individual. Somebody wants exotic marriages. Somebody wants decent marriages. So it goes. Depending on the family dynamics, culture, it changes.
Thank you, sir. Thank you so much for this wonderful session.
Sir, that was a very nice one, sir. Kumaresh, sir.
Yes, sir. Yes, sir. SIVAPRASATH,
Very nice
yes, sir.
session, sir.
Thank you very much, sir.
We always enjoy your freelance sessions, sir. You keep all the audience engaged without going for food. There are some chat box questions, sir.
Yes, please.
What about the insurance for dependent parents?
Dependent parent, who is dependent on them? Because already
That's a nice question.
Because there should be financial dependence should be there. Then only we should take life insurance. Dependent parent means why they need life insurance? Because already you are earning and they are dependent on you. So you should take life insurance for them. They should not take life insurance. If you want money when they die, that's the this thing. So I ask you emotionally.
Yeah, that's true, sir.
Yeah. So those who have got financial dependence, they should take life insurance. Not dependent parents or dependent spouse or dependent kids. No, we should not take life insurance in their name. It is emotional loss, not financial loss for that family.
Okay, sir. Sir, there was one question on where to keep emergency fund, whether it's an FD or debt ultra short fund, sir. Which is better?
Liquid fund. Just I would suggest to keep in arbitrage fund.
Okay, sir.
Because why means if you keep FD, every year the interest accrues and we have to pay 30% tax.
Yeah.
And every year we are not going to take money out for emergency fund. It is meant for emergency, earmarked for emergency. So we are going to take only if it is there happens. So what I suggest to keep it for arbitrage fund, even though it gives liquid fund returns and without any risk. It is tax efficient. It has got equal taxation. That means what? First to 1 lakh gain, there is no tax at all. After that, only 10%. But if you keep in liquid fund, 30% tax is there for the capital gains. So we have to see all these angles also.
Sir, can you just give a gist of your own insurance and medical insurance policies?
My own?
Yes, sir. What is your choice?
Yeah. The same question paper, for the same question paper, answer will be different for each and every city. For example, in some cities, there might not be. I might have taken one company. That company cashless scheme may not be available in the city also. Suppose in Solapur, what's the use of the taking the policy? So I suggest to do homework. 3 questions we need to ask while taking medical insurance policy. We have to go to the insurance department of the corporate hospital, the nearby or where we are going to get admitted in case of any emergencies happening to us. Ask in the insurance department which company is giving the amount that you are going to claim, apply for the claim. Suppose we are going to apply claim for 5 lakhs, they are giving 4.5 lakhs means that's a good company. And how fast they are going to give it means they are happy. They are giving your claim means easy. The processing is very easy. So the hospital will get easily that money. And third is number of cashless hospital in the city. Suppose that hospital, which company has got the maximum cashless facility in the hospital. Because if you met with an accident, if you admitted in cashless hospital, then everything will be go cashless. Otherwise, if you admitted in non-cashless hospital, first 3-day expense is huge. It comes to be 20-25 lakhs minimum. That we have to spend it from our pocket. That we don't have. Many of us don't have. Even I don't have. So we must do this homework every year. That varies from, depending on the city, it varies. I'm a financial advisor for 400 doctors and I have got doctor clients from various cities. So everyone is giving different policy names. In our city, this is very good. In our city, this is very good. So sorry to say that this is the best medical claim policy. I'm sorry, sir. It varies from city to city. I can't hear you, Suprasad. Please unmute me. Sir. Unmute yourself. Suprasad, sir, unmute yourself.
He's not able to unmute yourself.
Okay.
Okay, thank you very much, sir, for your wonderful presentation.
Thank you.
The speakers of today's sessions, Chaitanya Madam, Ganesh sir, and Kumaresh sir, and the moderators Karthik, SIVAPRASATH sir, and Santini Madam. Thank you very much. So with that, we end up this year academic session with a high note, with a very good presentation of our speakers. Next year, we are going to present this online anesthesia in a different platform. That is, we are going to upload 1 year recorded video every week. So anyone interested in teaching anesthesia can send the videos 1 hour recording to our online anesthesia at gmail.com. I repeat, online anesthesia at gmail.com. You can send your anesthesia teaching program, that is 1 hour self-recording. It will be telecasted in our online anesthesia YouTube, which has more than 10,000 subscribers and viewers more than 2 million. So I hope you will cooperate with us. With that note, I thank the organizers, that is the sponsor A1 Logics and the the sponsor Akrulla and the telecast A1 Logics for very good coordination of the technical aspect. A1 Logics, I thank the Shilpa and also our media partner Anaesthesia TV. With that, we come to the end of this session. Thank you very much. Thank you. We will meet the next year. Seasonal greetings for this year end and also happy advanced New Year 2024. Thank you. Thank you, Ananda.
Thank you, sir. Thank you.